Hello, everyone, and welcome to the Multicultural Media Online by New South Wales Health, hosted by the Ministry of Health, Multicultural Health Communication Service, supported by Multicultural New South Wales. Hello, I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today. And of course, we have Dr. Jan Fizzell, our Senior Medical Advisor, here today to answer your questions on COVID-19, on flu, monkeypox, and legionnaires' disease. Unfortunately, our special guest for today, Dr. Jeremy McAnulty, is unfortunately unable to join us as he has fallen ill, but hopefully we'll get him back next time. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present, and also pay respects to leaders and elders from multicultural communities joining us and represented in this meeting today. For Dr. Jan and myself, we acknowledge the traditional custodians of the land, the Camaragal people of the Guringai tribe of the Eora Nation. We encourage you to please ask your questions on the chat. We're so glad that you joined us again today. And please share any information that you'd like to share with the communities and those members of the media joining today. As we go through the session, my colleagues from the Multicultural Health Communication Service will also be putting links to resources in language for you to use on your publications and for your audiences. So shall we begin? Dr. Jan, how are you?
I'm quite well, thanks, Jess. How are you?
I'm good, thank you. You got a lot of updates to share with us today.
Yes, there's been a lot happening in the past fortnight for New South Wales Health. As far as COVID goes, we still are seeing quite high numbers of people testing positive each day, with around 10,000 people. Yesterday was 8,383 positive tests. And unfortunately, we are still seeing people pass with COVID-19. Yesterday, there were 9 deaths, 5 women and 4 men, and we have seen deaths dating back through the registry of births, deaths and marriages, where we do have some days where we're seeing a record of around 20 or more deaths in those days. We also are still seeing some slow uptake of the vaccine, but of the COVID-19 vaccine, but I just really want to emphasize the importance of the vaccine and the new availability of the winter booster dose to so many more people. Our experts in immunisation, the Australian Technical Advisory Group on Immunisation, have expanded the eligibility for winter boosters, suggesting that people with other significant chronic health conditions should be getting that winter booster dose. So please do encourage uptake of the winter booster in the community. It's really important. As we come into winter, we know that we're going to be spending more time indoors together. This local cold snap has probably brought many of us indoors when we've been enjoying much more of the outdoors. And that's a really good time for our respiratory viruses to spread. Speaking of respiratory viruses, we're off to quite a severe flu season already. We're seeing hospitalizations both in very young children, those who are age 5 and younger, as well as in older people. And we are seeing a number of people presenting to our emergency departments with influenza-like illnesses. Again, there is now a free flu shot to everyone in New South Wales over the age of 6 months. It's really important to get the flu vaccination. It does significantly decrease your chances of being absent from work, which is probably what will actually speak to many of us who've had time off either because of COVID isolation or other issues in our lives. So it reduces your risk of having time off work. In kids, particularly kids under the age of 5, they haven't met much flu in their life. So it could be absolutely life-saving for young children to get that flu vaccine. So please, again, those flu vaccines for the under 5s are free and readily available across the state. For people who are age 65 and older, again, particular vaccines are available to you that are there for your immune system, because your immune system can be a little bit weaker. There's a stronger vaccine for yourselves. And for everyone else, that free flu vaccine is now available. Please call ahead to your pharmacy or to your GP so that you can get those vaccines. We have seen a re-emergence of legionnaires' disease. Legionnaires' disease is a bacterial infection. The other two I've been speaking about are viruses, bacterial infection that can impact our lungs. We mostly see Legionnaires' disease from air cooling towers for air conditioning in certain local areas. And we have seen some cases related to the central business district of Sydney, but also when people are handling potting mix. So when you're replanting those flowers, I don't think it's replanting season at the moment, but had you been, it's really important to wear one of those P2 or N95 masks, because if you inhale those potting mist dust, you can also get legionnaires disease. So we are asking people who have been working or being in the CBD for shopping or other activities, if they do get diagnosed with pneumonia, to please remind their GP that legionnaires disease has been found in that area, and just to exclude that diagnosis. And then I think our last thing to update us on is monkeypox, which is something that we are seeing in a number of countries around the world. It's a disease that has been known since the 70s in people. Previously, we have had small outbreaks, either related to the export of small pets from Africa or spread from person to person. And again, we have seen some cases here in Australia, but more importantly, there are a larger number of cases in Europe in particular, and particularly in the community of men who have sex with men. So really important that people are very aware of this particular illness, and particularly if they've had an intimate encounter and find that they've got a rash around their genital area.
Thank you so much. Dr. Jan, there are a lot of questions about monkeypox and Legionnaires' disease, as well as, of course, COVID and the flu. First of all, there's a lot of news coming out of all these diseases, plus COVID and flu. How are we supposed to make sure that we're keeping in touch and we're not panicking and being anxious?
Look, I think it's a wonderful place to be a person working in public health at the moment, because usually we would put out an alert and most people wouldn't even hear us. But thank goodness people are hearing us, because they're used to us speaking about COVID now. So we don't put out these alerts lightly. We do actually wait until there is something there that people really need to be alert about, because a change in their behaviour or taking up a particular intervention could really change their health status. So in the cases of influenza, we're not telling you about increased cases to worry you. We're telling you because there is something there that can help protect you. Again, with monkeypox, it's something new and different. It's not something that we're used to here in Australia. And so again, by being aware of what's going on, of how you can be at risk. And it's mostly, people who spend a lot of time together, particularly intimately, who are most at risk. We can help allay the fears. If you walk past somebody in a supermarket, monkeypox is not going to be your problem. But we can also make sure that people who really do need to know, do know. And I think this is it, that we know that with the world opening up again, we are seeing a lot of travel of people from place to place, and we usually see legionnaires once or twice a year, but we work really closely with local government to try and keep those cooling towers clean so we don't have these outbreaks. But, with the global world that we live in, it's easier for diseases to travel.
Dr. Jan, you said that it's not about being inside, it's outside in those areas for Legionnaires' disease, isn't it?
That's right. So with Legionnaires' disease, it's not about being inside a building where the cooling tower isn't fantastic. It's about the fact that the cooling tower can actually spread those bacteria around it. And so we do tend to find in certain geographic areas, if we see one or more cases of Legionnaires' disease reported in people who've been in that particular local area, we then go and inspect those cooling towers with local government to make sure that the offending tower, as it were, can be cleaned. But that's why it's so important to ensure that if you do have a cooling tower, that there is proper maintenance done and that you are registered with the local government as is required for those buildings.
Thank you so much, Dr. Jan. And please, if you have any questions, please put them on the chat and we'll get them answered by Dr. Jan. Jan, there's some confusion about who are counted as age disability workers. The questions have been repeated as there's confusion about community-based workers opposed to those within buildings, and organizations' strong resistance against vaccinations. What is it that we should be reminding organizations in the workforce?
Look, I think the thing is that people with a disability, people who are older, have an expectation that the people who are providing care in their homes, in their residential facilities, providing them with a service that's specifically for a disabled person, should be vaccinated, because it does reduce your risk of spreading COVID to other people, and it reduces your personal risk of being infected. And by doing that, you also reduce the risk that you will get sick and not be able to provide that service. So it's really important that we look at the evidence. For a number of years, if you've had a cut from tetanus, we don't expect the tetanus injection that we had when we were 5 years old to still protect us when we were 50. We know that we're going to have a booster. We've been learning about COVID vaccines, and it's really important that if we have learned, which we have, that the first 2 doses give us some protection. The third dose is really, really important. That's why it's recommended. And that's why in some circumstances it's mandated to have that third dose of vaccine. And I know some people have had COVID and they say, well, for me, that illness was not that bad. Unfortunately, that's not true for everybody. Some people who have had COVID, really are very, very sick. And I know that in the week before last, all the people who were under 65 who passed were either unvaccinated or had not completed the course of vaccination that was appropriate for them. So it's really important that people understand that being unvaccinated or under-vaccinated does really increase their risk of those severe outcomes. And that's why it is so important that we as employers, as the community, do encourage people to get those booster doses. This is something that our scientists are looking at, our health experts are looking at, to try and make sure that they give us the best possible advice, which is why there's different recommendations for how many doses different people in our community need to have. So, for example, for the winter booster at the moment, our expert groups are saying, whilst pregnant women are at higher risk of COVID-19, we recommend that you get your primary course, so your first 2 doses and 1 booster, but not to get the winter booster. Whereas people with heart and lung disease and other illnesses, we do recommend the winter booster. So they're really looking at the evidence for each part of that population and considering really carefully which parts of those populations will benefit most from these recommendations. And so I think when those experts are ready to spend that time, look at the evidence and do that incredibly hard work of thinking through what is the risk and benefit, it's worthwhile having trust in those experts to do that work.
And even with influenza flu being available for a month, that's fantastic. And that a Medicare is not required if you go to the pharmacy.
Absolutely. So this is something that's really important. Again, usually we only do free flow vaccine for the people who are most at risk of having a severe illness. However, this year we're seeing such an increase, and so early in our flu, that that decision has been made to try and protect people and try and protect our healthcare system by offering that vaccine to more people. People who'd already gone and got the vaccine, that's fabulous, because you will have had protection during that early time when we were still, we didn't know that we were going to have such a bad season. So a whole lot of people, by having gone and got vaccinated already, have prevented illness. But now that we are offering it to more people, we're hoping we can protect more people in our community from what looks like a really hard flu season.
Thank you, Dr. Jan. And a question from Violi Calvert, and you probably have mentioned about this. What are the precautions not to get monkeypox? And you mentioned it. That's Violi Calvert from Radio Tagumpay, Filipino Radio, and what are the symptoms? But also question about vaccination. So for monkeypox, we've been hearing vaccination for flu, for COVID. There's a question about that.
So monkeypox is in the same family of viruses as smallpox and cowpox. So there are vaccines that can be used. Those vaccines have got their own risks and benefits. So again, when it's useful to be vaccinating certain people, so that could be people who work in laboratories, that could be people who've been in very close contact, who have a poor immune system. Those people who have been in very close contact will have some individual advice as to what is most appropriate for those people. But as a general population initiative, that's not recommended at the moment. The biggest things we can do to prevent monkeypox, the first thing is it takes a lot of face-to-face time for any droplet transmission. So wearing our masks when we're in public and around different people is still a really good idea. And again, just being really frank with our intimate partners about any rashes or anything else we've got. And if we do have any rashes or anything interesting in our intimate areas, to be very honest and forthright. We've got a number of free sexual health services. So even if you don't have a Medicare card, you can go to one of the New South Wales Health free sexual health services. Or, you know, if you have a trusting relationship with your GP, go and talk to them. They're used to seeing people. There is no need to be embarrassed. And people's confidentiality is absolutely ensured. So I know that sometimes people do have experiences outside their usual relationship with a spouse, and they might be very worried that if they go to a healthcare provider that they're going to tell people. That's not how things work. Again, just as we tried to respect people's confidence in COVID, we'll be respecting people's confidence with these types of illnesses. So it's really important that people do just stay healthy and take those steps to maintain their sexual health as well as their other health.
Thank you so much, Dr. Jan. And you've seen on the chat some links to some translated resources on monkeypox and legionnaires' disease. So that's available for you to use. Dr. Jan, there's a question about taking several COVID-19 vaccines. And you mentioned this. Why is it that why can't we just have one when there's a flu vaccine when it's an annual one?
Yeah, so for flu, we had a lot of information by the time we had a pandemic back in 2009, and we knew that we were going to have a strain-specific vaccine. We knew that we would have it developed in 6 months, and we knew that it was probably going to be, you know, a certain amount of effectiveness. And that's because we'd had flu vaccines for years and years and years. We haven't had a COVID vaccine for years and years and years. And for most of the time that we were developing the COVID vaccine, the virus was very stable. It did not change a lot. And we were really excited because when you've got a virus that doesn't change a lot and you vaccinate the population, you expect that disease to just about go away. Unfortunately, COVID had a number of tricks up its sleeve that we weren't expecting. And one of those tricks is it's been very adaptable and it manages to change. And so people who've either had COVID before or who've only had 1 or 2 doses of vaccine remain quite susceptible when COVID changes. What we've been learning is that different people need different amounts of vaccination to be able to be protected. So people who are profoundly immunosuppressed need more doses of vaccine because their immune system's less likely to respond well. And again, people who are at very high risk of severe illness, again, we need their protection to be really, really high so that when the time comes that they actually go and come up against COVID, they've actually got that really, really high protection. For the most part, 3 doses for most adults is really protective, and it doesn't matter whether you get 3 doses of the same vaccine or 3 doses of, you know, you had 2 Pfizers, 1 Moderna, 2 Modernas. 3 doses seems to give quite good protection for most people at average risk. And so I think that's why we're learning, and we're learning all the time, and we know that people are putting a lot of time and money investment in trying to make sure that we get better vaccines, and we have more certainty with what happens when we vaccinate. But I think the key thing is that these are resources that are important. And so when people are willing to use an important resource to help protect people's health, we should encourage people to, you know, make the most of that opportunity.
And just to be clear, Dr. Jan, the vaccination again for COVID is not going to protect you from flu.
Correct. So if you have a flu vaccine, it won't protect you against COVID. If you have a COVID vaccine, it won't protect you against flu. They're quite different viruses. They look a little bit the same under an electron microscope, but it's a bit the same as a hyena looks a bit like a wolf. They're very, very different animals, even though they've got the same shape and, you know, have a lot of the similar behaviours. They're very different animals. So COVID vaccine for COVID, flu vaccine for flu, and both are recommended this year and both can be given at the same time.
Thank you, Dr. Jan. With all these sicknesses and that's coming around with the flu, we have to save our emergency departments, isn't it? We have to make sure that we present ourselves accordingly.
That's right. So this is why New South Wales Health has put an enormous investment in a COVID and flu helpline. So if you test positive to COVID or flu, there's a fact sheet that's available that's been translated into a large number of languages that gives you a phone number to call if you need medical advice while you have COVID or flu. Again, if you've got other illnesses, please use our General Health Direct 24 hours, 7 days a week helpline. They are there to help you no matter what. If you're worried about, I've sprained my, I've twisted my ankle, it's a bit black and blue, do I have to go to the hospital, through to, I've got a headache and it's been bad, I haven't had a headache like this before. All those things that might take us to emergency. If you are well enough to have a good conversation with someone, that's your first thing to say, okay, I'm well, I can concentrate on having a conversation with someone. That's a really good thing to sort of say. If you're that well, emergency is not the first thing you need to do. Call Health Direct and they will actually help you work out whether you need to, call an ambulance, head to your GP and give you a time frame for that sort of thing. So it may be about do these things, and if that doesn't work, you need to go to hospital, or it may be you don't need hospital, you can wait and see your GP, tomorrow or even next week.
Thank you, Dr. Jan. And as Dr. Jan said, call Health Direct, or if you need language support, call TIS National at 131450 and ask for Health Direct. Dr. Jan, mandatory masks, there's just a lot of complacency with wearing masks. We have this campaign, which is here, little things does a big difference. But what is the advice of New South Wales Health? Because a lot of people are saying if it's not mandatory, then it's the norm, it's okay.
Look, I think it's really important that we remember we don't need a public health order to be told to wash our hands. We don't need a public health order to dispose of our tissues nicely in a bin. And we shouldn't need a public health order to reduce our risk of COVID, flu, and other respiratory viruses. And one of the best ways we can do that is to wear a mask when we're indoors and we don't know if we can physically distance. So that could be a circumstance that, today I went to the shops at lunchtime. I put my mask on because I don't know that I'm going to be able to physically distance when I'm in the supermarket. If I was catching the train home, I know that there's going to be a lot of people on that train. It's mandatory for me to wear a mask while I'm on the station or on the train. But also I know that other people on the train may have disabilities, they may have reasons they may not have a mask on, and one of the best things I can do to protect myself is to put that mask on, but also I can help protect other people. And so those masks do reduce your risk of transmission significantly, and they do reduce your risk that you will catch something significantly. So it's really important that we just take responsibility for our health and we wear our masks.
Dr. Jan, if you do get sick and you feel unwell, take a PCR test, and rats are still available. Is that the same advice?
So the key thing is if you're not at really, really high risk of having a bad outcome from COVID, and those scenarios are available on some of our information available, again, in multiple languages, the rat test is probably what you need. So use your rapid antigen test, and if it's negative and you're not well, you could either repeat that test the next day, but you may also have one of the other illnesses that are floating around at the moment, such as respiratory syncytial virus or influenza. For people who are at higher risk, though, getting that PCR test will guarantee your connection into care. And what will happen is there'll be a survey to sort of say, are you at higher risk of having a poor outcome? And those people with higher risk will be trying to reach out to you to try and either make sure that you have an appointment with your GP to talk about medicine, or that a New South Wales Health facilitated GP appointment can be made to help. And the really important thing is for people who are unvaccinated, people who are at high risk for a poor outcome, people who are older, and anyone who's immunocompromised, there are now tablets available on prescription from most chemists that can actually help prevent hospitalization from COVID. So even if you're vaccinated, if you've got some very significant health conditions, those tablets can help prevent hospitalization. So it is so important that if you do get COVID, if you've tested positive, that you do reach into that 1-800 number and make sure that you talk to somebody about whether you need to be treated for COVID-19 or not, because they do work. There's new trial evidence all the time showing that it's going to reduce the risk that you will be hospitalized from COVID.
Thank you, Dr. Jen. And I guess the concern is if they don't want to call that number, they can contact their GP.
Absolutely. So again, GPs are able to prescribe these antiviral medications now. They don't need authorization from the Commonwealth. There's some clinical guidance out there to help GPs decide whether you should have them or not. And those GPs will make those decisions.
Thank you, Dr. Jen. Going back to the vaccine, the COVID vaccine, there's a question, does it affect children's physical and mental development that include puberty? And also there's been some information going around that the vaccine or booster was because of that, monkeypox was a result of it.
Yeah, so let's tackle the first question first. No, there is absolutely no way that those boosters can have any impact on your growth, development, future fertility, or anything else. Those vaccines, we're made up of cells, and those cells have instructions in a part of the cell called the nucleus, which is where our DNA is, and our DNA tells our body how to make proteins by stuff called mRNA. Those mRNA vaccines are nowhere near our DNA. They're out in the cytoplasm, so in the blobby bit of the cell. They're not in that nucleus. And so it's really important that people understand that those mRNA vaccines can't impact your DNA. It's one way from your DNA to the mRNA to making a protein that helps our immune system, develop immunity from the viruses. So no, if anything, again, it's more likely to protect you, because we know that kids who get COVID, even kids who get long COVID, are more likely to have problems with schoolwork and so on, because, thinking slows down, some of those cognitive processes slow down. So we can actually protect young kids, teenagers from some of those issues with long COVID that they're describing in the United Kingdom by actually vaccinating them, because it helps prevent long COVID as well. I think the second question is, are we seeing all these other infectious diseases in Australia that we haven't seen before? And the answer is no, it's got nothing to do with the vaccination. We are looking at evidence that suggests that the monkeypox virus has possibly been circulating in low levels in Europe since about 2017. And probably all the lockdowns and all the restrictions in travel probably stopped it from moving around as much as it was. And then again, people are able to travel, people are able to be together again, which is what people love to do, and our viruses go with us. And with Japanese encephalitis, again, we've seen a change in mosquitoes and what the mosquitoes are carrying, and that's how the Japanese encephalitis has come about. I think we've had our friends from Animal Health warning us for a number of years that climate change, with changes in the ecology of what mosquitoes are carrying and what mosquitoes are doing, can actually increase the spread of some of these diseases. They're called zoonoses because they come from animals, zoo, to us. And this is one of the things that, climate change may be impacting, is the frequency with which we will see some of these zoonoses. I mean, after all, COVID-19 is also a zoonosis. We think it's come from a bat.
I learned one new word today, Dr. Jan, zoonosis. But Dr. Jan, what you said is really important, is that since our borders have opened up, there's a lot of diseases or a lot of illnesses that have come through, and that means that we have to be extra careful.
Yeah, and I mean, we saw this week, there's been a study from Sydney University where they were looking at respiratory syncytial virus. Now, that's a common virus that causes colds in adults, but can cause bronchiolitis and croup, that really horrible type breathing when little kids have it. And they saw that when Western Australia closed its border and Eastern Australia wasn't able to move, and we weren't seeing a lot of imports from overseas, that the RSV circulating in Western Australia looked different to the RSV circulating in Eastern Australia. Once the borders have opened, things change. And so viruses can only go where we let them go, and most of them go where people are. And so when we've had fewer people moving about, fewer viruses have moved with us.
Thank you so much, Dr. Jan. And we've run out of time. So just one final words, Dr. Jan, to everyone.
Look, I think the thing is, it's winter. The little things that we can do are the things that will really make a difference this winter. So those little things are keeping up to date with our vaccinations, both for influenza and COVID, making sure that if we're unwell, we stay home and don't go out, making sure that we wear a mask, particularly if we're going to be indoors, and particularly if we're in a situation where we know we're not going to be able to physically distance. And really important, and it's not such a little thing, it's actually a really big thing, just being kind to each other and being thoughtful, because I know there are still a lot of people really struggling with either fears about vaccination, fears about getting COVID, fears about flu. And I think just being kind and careful with each other, especially our healthcare professionals, they've been under a lot of strain for a very long time. So please, if you do have a healthcare professional in your circle, reach out to them, make sure they're okay, because it's still tough going out there.
Thank you so much, Dr. Jan, for joining us again today. And we'll be back in another fortnight. That's on June 15th, Wednesday, same Zoom time, same channel. So please join us again next time. And for the recording of this session, we'll have it on the New South Wales Multicultural Health Service website, and we'll send that through to you in the next few days. So thank you so much. If you have any suggestions for health topics you'd like us to raise here on the Multicultural Media Online session, we're happy to do that for you. Thank you so much. Take care. And as Dr. Jan said, be kind to one another. Thank you.